The USMLE has many subjects that are tested. One of the most difficult is pharmacology. Studying for pharmacology for the USMLE steps can be very challenging. In this video, I intend to discuss how I organized the pharmacology subjects on the USMLE and how that organization helped me to be able to retain information and also be able to apply them on the USMLE Step 1 and came out successful on the Step 1 exams. Hi friends, my name is Jerry and I am an international medical grad. I stay here in Houston. I live here and I'm working currently. And if you have not yet subscribed to this channel, I implore you to do so and join me in using this channel to help medical students in general, the future ones and the current ones who are studying for the USMLE. If you're also a returning subscriber, I must say I'm very grateful for you watching my videos and also learning something from me. All those who have contributed to this channel, I am very grateful to you all, and keep up your good works. So let's go to the content of this video today. Now, pharmacology is one of the most difficult subjects because we have many drugs, and then before you understand pharmacology, it means that you should understand generally every system in the body. You should have a general idea of every system in the body in order to be able to relate pharmacology and then the drugs to whatever is happening and their side effects. So just as other subjects, pharmacology, you have to study it systematically. You have to group all the drugs. That's what I do. So you group all the drugs and know the class of each of the drugs, so that if you study them according to their classes, then you don't have to study each drug one after the other. So try to study them systemically and also by class. If I say by class, for example, if you are taking beta blockers, you should know the types of beta blockers that we have. If you are taking calcium channel blockers, they are a class. If you take all other classes, you should know which drugs falls under them. If you take antibiotics, you should know which are the penicillins, which are the cephalosporins, and in that way it becomes easier for you to remember. Now, when it comes to the system specific drugs, they sometimes overlap, so we should take note of that. Now let me just go through how I organize these drugs and then how you should know them. These are the most important points. This and what I'm going to talk about is not everything complete, but the most important things that you are likely to see on your Step 1 exams. And if you know the things I'm going to talk about right now, you should be good for pharmacology on your Step 1 exams. So the first ones are that you have to understand the basic pharmacology principles, the very basic. Before you go and start learning about the drugs for pharmacology, you have to understand the basic pharmacologic principles. One, you have to understand the inhibitors, your competitive inhibitors and the non-competitive inhibitors. You have to understand the Michaelis diagrams and also the Lineweaver diagrams. Those ones, they are very difficult because there is not much information about them, and sometimes we use pattern recognition to understand them. So if you are able to take your time and understand that very well and also have a pattern, because on your Step 1 exams you are likely to meet one question or the other. What they usually do is they draw the diagram for you and then you have to interpret the diagram. So and it's that easy. It's an easy point to get. So you just learn the competitive, the non-competitive, and you should be able to replicate the same knowledge on the Step 1 exams. Again, I repeat, they usually draw the diagram for you and you should tell whether it's competitive and non-competitive inhibitor, it's an agonist or an antagonist. So you should be able to know that. Now, one of the things that people do is like also to cram some of the things in the basic pharmacology. For example, when it comes to knowing the equations that we use for drug calculation, you should be able to know your calculation for your loading dose, the maintenance dose, volume of distribution, clearance, half-life, and other like dosages. So if you are able to master these calculations, then you are able to, what get another easy point on pharmacology. So these two things, the inhibitors and also your calculations, you are likely to get 2 questions from this two that I've talked about right now, and mark it. You'll come back from your exam and tell me, yes, you got something on that. So learn how to calculate how to calculate the volume of distribution, the clearance, the half-life, the dosages, and how to do change of subject for all the parameters in the equations, and then you will be able to get some easy points on the step 1 exam. Now let's go to beta blockers. Beta blockers fall generally under anti-arrhythmic drugs. They control the heart rate. They are the rate control drugs. So anti-arrhythmic drugs, we have calcium channel blockers, we have beta blockers, we have those that block potassium channels also, and also the last ones that, so my mnemonic is calcium beta kill potassium. No, sorry, sodium beta kill potassium. Sodium beta kill potassium. So sodium channel blockers, calcium channel blockers, the beta blockers, and also the potassium channel blockers. So if you are able to group all these ones also, then you can appreciate them. The most important ones that you want to know over here under the anti-arrhythmic drugs are your sodium channel blockers, because they are broadly used. Some of the sodium channel blockers are used for anesthesia, the local anesthesia, and even general anesthesia. Like you have lidocaine. Lidocaine is used for local anesthesia. Bupivacaine is used for general, also used for local anesthesia, or sometimes combined with others to make the general anesthesia. So you should be able to classify these antiarrhythmic drugs. Again, let me stress on this: for the sodium channel blockers, the class 1A are the most important ones. The class 1, the class 1As are the most important ones, and you have to be able to understand how those diagrams are drawn. So please do well to understand how the diagrams are. So on the step 1 exams, what they do is that they draw the diagram for you, and you should be able to determine that this drug is maybe a class 1 anti-arrhythmic. The class 1s are the sodium channel blockers. So if they give you the sodium channel blockers, we have the class 1A, class 1B, class 1C, right? So now if you sit for exams, and what they'll do is that they will give you a diagram. It could be class 1A, class 1B, class 1C. Class 1As are the most broadly used, but it could be any of them. So try to understand how each of the diagrams look like. In future videos, I can explain how the diagrams look like, but right now I'm just giving a general overview. So if you understand how the diagrams look like, it's just a pattern recognition. You go into the exam, then you know the pattern, they draw the diagram for you, you just choose your answer. This is class 1A, and then you go your way. And then if you remember the mnemonic, it says what? My mnemonic for the class 1 is the queen proclaims disopyramid. That's how I say it. So I say this constantly and it sticks in my mind. So quinidine, procanamide, and then disopyramid. So these are the class 1As. Then the class 1B is also there, and then the class 1C is also there. So know how the diagrams look like. Now this let's talk about beta blockers now. Let's come to beta blockers. We've talked about the antiarrhythmics. So we've talked about the class 1s. And then let's look at the beta blockers. Beta blockers are the class 3, and generally they are used to treat angina. They control heart rate. They give them in heart failure, and also some essential tremors that it can be used to treat. Also, supraventricular tachycardia can also we can also benefit from that. And then we also have to understand that it can also cause toxicity, or they can also cause some side effects of bradycardia. They can cause sedation, and also sexual dysfunction, and it can also be used as an antidote to atropine overdose and so on. So now Another thing that we have to know is the calcium channel blockers. You have to understand them, what they do. They block calcium channel on the blood vessels or in the heart, so that when they block them, calcium remains inside the heart muscles, and then the heart can contract better. And that is one thing that we should also know. We also have those that block the potassium channels, and then we can appreciate them also. Not very, very important. Let's look at toxicity. Toxicity of drugs are something that is very frequent. So when you're in the emergency department, you come to most of the patients that come have ingested a certain drug that is toxic to their body. For example, Tylenol, aspirin, and so on are common things that people ingest. And so when they come, as a physician, you have to know how they look like when I ingest aspirin, how my symptoms will look like, and then what drug you are going to use to counter them. So it's very important that we understand the toxicity and then the antidote of those toxicities. For example, acetaminophen, which is Tylenol, the antidote to be N-acetylcysteine. Benzodiazepine, we use flumazenil for it. Also carbon monoxide, we can also use hyperbaric oxygen. Heparin, we can use protamine sulfate. Methanol, we can use Formipixel. And then another one is opioids, like opioid narcotics. We can use naloxone, warfarin, we can use vitamin K, and maybe fresh frozen plasma. So this is something that you have to know. Is spelled out in step 1, the first aid. And so antidote is something that you will surely meet a question on antidotes also. Let's go to the cytochromes. So for the cytochromes, what it does, metabolize drugs. So there are enzymes in the liver that metabolize drugs. So we have drugs that can induce the cytochromes, and also drugs that can inhibit the cytochrome. It's very important for a physician to understand which drugs. There's a painful list of inducers and also inhibitors, and also drugs that are being metabolized by the cytochrome. So knowing the inducers and also the inhibitors will help us to be able to understand what will happen to, for example, if somebody is on warfarin and is taking an inhibitor. It means that the cytochrome will be inhibited from breaking down warfarin, so there'll be excess warfarin in the person's body, and then the person's INR is going to increase, something like this. So you have to understand which ones are the inhibitors, which are the inducers. Also, if someone is on warfarin and is taking an inducer, it means that the cytochrome will be induced so that it will break down all the warfarin, and the person's warfarin will not be effective. You are giving them warfarin, but since you are giving them an inducer, the inducer induces the cytochrome enzyme in order to break down warfarin, and you will not see any effect of the warfarin. So it's something that we have to take note of. The list is in first aid, so I will not go through them. Now, the next thing that I want to talk about, that I should have even talked about before coming here, is the naming of the drugs. Naming of drugs is very important. Try to recognize the names of the drugs by using some keywords within them. Some of the drug names have some clues within that you can easily use. Not all drugs follow this pattern recognition, but yes. Now, the next very important thing that you are most likely, 85% likely to get a question on, is diabetic drugs. So diabetic drugs is something that you have to really understand, because generally about 50% of the population have diabetes, and then understanding diabetic drugs is very important. You should be able to classify the diabetic drugs and also know the examples under each of them, and then the side effects. One thing that people usually forget is that metformin, prolonged use of metformin causes vitamin B12 deficiency. So if your patient is on metformin for a long time and then they start having neuropathy, start adding vitamin B12 to their treatment. Most physicians neglect this, and it is not very helpful to our patients eventually. So let's start adding vitamin B12 to patients who are on metformin. That really helps them. Yeah, so understand all the classes of diabetic drugs and their side effects, very, very important, and also know the enzymes that they are blocking. Now, the next thing is under diabetes, also understand insulin, the types of insulin that we have, the fast acting, that's the Lispro, and also the long acting, the Lentos or the Glycogen, and also the intermediate, which is the NPH, which you understand how they also work. The next thing that you are likely to get question on is the lipid lowering drugs. Your statins, you have to know what they block, HMG-CoA reductase. You also have to know your fibrates. You have to know your vitamin B3, what it does. Very, very important. One clue for the answers for this is that most of them always increase LDL receptor expression. The more LDL receptors that you have means that your liver has more receptors to take away your cholesterol from the blood into the liver, so you don't have a high number of circulating cholesterol in your body, and that is very, very good. So increased expression of LDL receptors is something that is the baseline response to most of this cholesterol or lipid lowering drugs. Now, we talk of the antiarrhythmics already. HIV drugs is very important. In understanding HIV drugs, what I did was that I took almost like a whole day to understand HIV drugs, repeat them, because they are not something we commonly see. But you, as a physician in the US, you have to understand the HIV drugs. If you take them, they are classified into the new NRTIs, NNRTIs, the protease inhibitors, and also the integrase inhibitors. We also have the fusion inhibitors and CCR5 antagonists. So try to classify them this way, and also be able to know which drugs fall under each of the classes, and then the side effects are very, very important, and also how we combine these drugs for someone who has HIV. So know how to identify the names of the HIV drugs. If I mention any HIV drug, you should know which class it falls under, and that is very important. And also, you should know which HIV drug has which side effects. For example, if I ask you which HIV drugs causes obesity in a patient, like, you should be able to know. If I ask you which HIV drug causes hyperlipidemia, you should be able to know which HIV drugs causes increase in glucose, as hyperglycemia. You should be able to tell me the answer, and that is very important in your prep for the USMLE exams. The next thing I'm going to talk about is the central nervous and the peripheral nervous system drugs. So this section is very important. It means that you must have a fair knowledge of the nervous system. You should have a general overview of the nervous system. Like when we have the nervous system, you have the brain and the spinal cord. As the spinal cord is coming, there are nerves that are branching away from them. First of all, some nerves branch and they stop over here. They are the presynaptics, and also let's say preganglion, because they come out first and then they stop here, they form a ganglion, then the other nerve also goes from there to the organ. So these are the preganglionic from the spinal cord. So all the preganglionic, the general thing is that they all release acetylcholine. That's what you should know. All preganglionics release acetylcholine. You should know that. Then now the postganglionics are those going to the organ. That's where they are divided into the sympathetic and then the parasympathetic. So you should know which one is going to which organ and then its effect. Now, when these nerves reach the organs, now they also synapse they have receptors that they work with. So when the nerve gets to the organ has a receptor. The nerve releases its neurotransmitter onto the receptor, then what will be the effect of that neurotransmitter on the organ? So if I have the spinal cord this way, and for example, if I have let's say a sympathetic nerve coming off it, and then it's going to the heart, if the heart is receiving epinephrine from one of the sympathetic nerves, and then the epinephrine is going to work on let's say it's going to work on the beta receptor, what will be the effect if epinephrine binds to a beta receptor on the heart? You should understand. If the vagus nerve is also coming into the heart, and it's going to work on the M2, I believe, M2 receptor on the heart. Now, what is going to happen to that the heart when it works when the M2 receptor is being activated? So it's something that we have to understand in general to be able to be ready for the USMLE exam. So, and also for our clinical practice in future. So so you have to understand the sympathetic and then the parasympathetic system. Generally, the sympathetic system, it activates and parasympathetic deactivate, but then it's not in all systems. In some systems, for example, the GI tract, parasympathetic is going to activate the GI tract. Sympathetic will reduce the effect, the action of the GI tract, to slow down the GI tract. But then if I go to the heart, sympathetic will activate the heart, parasympathetic will slow down the heart. So you should know that this is not like a general rule. So you should know which organ has which receptor. You should know the distribution of the receptors in the body. Which receptors are on the liver, which receptors are on the heart, which receptors are on the muscles, which receptors are on some parts of the brain are very important. If you don't really understand this, then I will implore you to watch some Dr. Najib videos, because he really takes time to explain this very well. And this is one of the best ways to get a good foundation for pharmacology. Yes. Now, one thing that I want to mention is that all the presynaptics use acetylcholine. All the preganglionic sympathetics all use acetylcholine. The sweat gland is the only one that uses both acetylcholine as preganglionic and also use acetylcholine as the postganglionic. So that's something that you have to understand very well. Sweat gland is always an exception. Next thing that I'll talk about is the G protein linked second messenger system, or you can call it the G protein coupled receptor system. Now, this is also very important, because after this sympathetic system is being activated, we have to understand that when sympathetic or parasympathetic acetylcholine or epinephrine bind to their receptor, the beta receptor or the alpha receptor, now they need to trigger an intracellular activity. Inside the cell are certain proteins called the G protein coupled receptors, and then they have different parts. They have the G inhibitory, GI, GQ, and the G stimulatory. So you should understand how they also work, and then which sites of the body they are found, or which organs they are found on, and then if you have a neurotransmitter acting on them, what to be the effect on the cells. So that is very important that we understand. It is the mnemonics, and then they are simplified in the first aid with some mnemonics, so we can also appreciate that. Now, when we come to the anti-muscarinic system, we can, and then the anti-muscarinics is something that you should understand, because atropine is a very important drug that is used in the emergency room. So atropine is an anti-muscarinic. Remember, it is not it doesn't work on the nicotinic, because the nicotinics are on the muscles, but the muscarinics are on our organs, like if you take in the GI, the salivary glands and also the heart and all those things, they all have the muscarinics, but the muscles have the nicotinic acetylcholine receptors. So atropine, as I said, is a very key drug. It is used it is used in the ACLS algorithm for symptomatic bradycardia. So if somebody is having bradycardia, then we use atropine to block the effect of acetylcholine, so that the sympathetic system can gain more power to stimulate the heart. Now, when you learn about this system, the muscarinic system, you realize that we have this mnemonic that says dumbbell. Like if somebody has organophosphate poison, or if somebody has if you remember that if someone has organophosphate poison, or they have excess cholinergic overflow, then they will have this dumbbell mnemonic. And then atropine does the opposite of the dumbbell, so it's something that we have to take note of. Now, sympathomimetic drugs are also a very high yield. They are very high yield sympathomimetic drugs. Among these are the epinephrine. Epinephrine is something that we have to pay attention to. It works on the alpha and then the beta receptors to affect the changes in some organs. Epinephrine is very important. And also a drug like isoproterenol, we have to understand it. We have to understand how dobutamine also comes into play. And one thing that I did was that I tried to compare all the drugs with the receptors, so that which drug works better on which receptor. If I take norepinephrine, it works better on the alpha than beta. If I take isoproterenol, it works better on the beta receptor than the alpha receptor. Now, if I take epinephrine, it works equally on both receptors. So when you give epinephrine to somebody, everything increases, heart rate and everything, blood pressure and everything will increase. But then if I give not epinephrine to somebody, it works more on the alpha receptors. Alpha receptors are more in the periphery. So in that case, they are going towards what they will do is that they will not cause reflex brady, but rather cause tachycardia, something like that. So you have to understand that also. And then the beta receptors also, dobutamine and then the isoproterenol are something that works on them. So understanding this will help us to predict the effect or the side effect of a drug, so that when I give a certain drug, I know it's working more on the blood vessels. If it's dilating blood vessels, then it means cause reflex tachycardia. So it's something that we have to understand. So this is how I organize my pharmacology. Let me just add quickly the antibiotics. The antibiotics is also something that you have to appreciate. And so in the antibiotics, you have to know which one belongs to which class, and also some examples. If you take the cephalosporins, try to break them down into first generation, second generation, third generation. If you take penicillin, know which one works more on maybe staph, or which one works more on the other microbes, because we have some methicillin resistant drug, staph aureus, and then we have to switch to vancomycin and all that. So try to understand how this antibiotics works, which enzymes are they block in the body, and that generally antibiotics are not really difficult. So I would just want to end the video here, and I hope you learned something from this video. Good luck in your studies, and if you don't understand something that I said, you can just leave a comment in the box, or if you want to add a contribution to whatever I've talked about, just leave a comment in the box. And I wish you good luck in your prep for the step 1, and I wish you good luck in your future career. Thank you, and I'll see you in the next video. Bye bye. Have a good night.